well there. They've not had a ton of cases, and but nonetheless, good to get her vaccinated. All right, so we're on the Facebook. We'll get going here in a minute or so, looking for the mayor.
Penny, with that rain coming in first and then that snow later, we're going to do some pre-treating, and we'll probably have guys out all night. I haven't touched base with Toby yet, but will this afternoon. But we'll hopefully have all those roads cleared for you.
I have no doubt.
You get up early, but maybe we'll be going to bed about the time you get up. I have a feeling we may have a long night ahead of us.
I hope it is much quieter than anticipated.
Me too.
Let me know if you need anything, Allison, as always.
We will.
You know I'll be available on text.
Okay.
So I'm just waiting for the mayor. I don't see Kirk either, unless I've just missed him.
Yeah, I don't see Kirk either.
You could always start with Penny and Brian. Here's Kirk.
Hey, good afternoon.
Hey, Kirk.
Hey, Kirk.
Hi.
Sorry, Chuck.
Oh, no problem. I need to fix a mic issue here for just a moment, and I'll be right with everybody, and we'll get started. Okay, I think the gang's all here. We'll get going. So we'll need to, Julie, I think you may need to mute there. I'm gonna go ahead and mute you. So welcome everybody to our weekly briefing about the COVID-19 pandemic with Indiana University Health, City of Bloomington, and Monroe County. I'm Chuck Carney, Director of Media Relations for Indiana University, and we will take media questions after opening comments as usual. We'll start off again, as usual, with Bloomington Mayor John Hamilton.
Thanks very much. Appreciate everybody being here. I want to give some quick updates with some data, as I try to do usually. Our employee numbers, we just put out the press release yesterday. We now have had 58 employees. We had 2 additional employees this week test positive. I will note we seem to see stabilization in those numbers, which had increased quite a bit in early December, mid-December, but they seem to be stabilizing. I hope that's the case. Certainly emphasizes the need for continued vigilance as we all protect with masking and distancing. Vaccinations are definitely underway in our workforce, particularly with police and fire fighters. Indeed, 54% of our firefighters have now gotten their vaccinations, including some have actually completed their second dose. I don't have that data yet for police on the percentage, but I hope to have that next week for you to keep track of our employees' vaccinations, and additional programs like the Rapid Response Fund, the loan fund, is continuing in operations, nearly $2 million made available, and continued support for our social safety net through Recover Forward and other approaches. You know, I believe so strongly in transparency. I so appreciate this weekly event to do that. It's important to hit some of the numbers that we see. In Indiana, 80% of the counties are rated 3 or above on the Indiana map. I know you all have access to that. There are only 3 counties in the state currently ranked 2 or below, and that includes Monroe County. We're the only urban county so rated. So thanks again to people for all the good work. There are some areas of local concern. There are now 5 positive cases in the isolation shelter. And there's some indications we've seen, and I don't know if Penny Caudle gets this too, about group home numbers from some of the providers in group homes that emphasize the importance to keep watching. On the other hand, as I often talk about state data, and again, this is available to everybody, but just to emphasize, really since early or mid-December, As we've seen now, some trends actually at the state level, cases, deaths, and hospitalizations are all mitigating to some degree. We don't know if that's steady, but it's better than the opposite, which we saw really through the fall. I hope that stays. It will only stay with our continued work on the two big things we need to keep doing. And thanks to all who do it. One is the protective actions of masking, distancing, good hygiene, staying home when sick, not sharing air when we don't need to. And second, of course, vaccinations. And I'm sure we'll go through those numbers. The state database lists 5,700, 5,800 vaccinations locally. I know our sources are a little more up to date than that, and we'll hear that, which is outstanding to keep that flowing from IU Health, from the County Health Department and others. And also, I expect we're going to hear some important news from IU as well on their plans on vaccinations. So thanks to all for all you're doing, and I'll hand it back to you, Chuck, and take questions.
Okay. And in fact, I think I'm going to go ahead and go to Kirk White, because any moment now there will be a news release coming out that has to do with those plans. So Kirk, why don't you address that?
Great, Chuck. That's thank you, Mayor. That's pretty good transition. I guess I'll just lead with that one. Over the past several weeks and really months, as we've discussed how best to make the vaccine available and how important it is for us to get vaccinated and get our economy and our population safe again. The university's been looking closely at how best to do that. And we realized as the plan started to unfold from the federal, state, and local levels that this was going to be an all hands on deck project. And so we've been looking over the past several weeks to figure out how best for us to vaccinate our own population. But at the same time, we've been asked by the university administration and Provost Rebel, at the executive vice president and provost for Bloomington, asked us particularly to take a look and see how could we make this available to the community as well. And we figured out that we can do that. We've looked at the great success that we've had in mitigation testing and flu shot administration. So we're just announcing today, Provost Rebel is issuing a release that explains that the university administration has directed the staff to move forward with the plan that we make the university facilities and our staff, in cooperation with the Monroe County Health Department and other local government entities, we're going to make the university campus vaccine administration sites available to the general public as well. So in addition to vaccinating our own population, we'll be able to add one more site to that list of locations that you find when you go to ourshot.in.gov and look for the places in Monroe County. IU is going to be on that site just as soon as we can get vaccine supply and pending those final requirements and approvals from the state. So we're very excited about that. And I think our track record working this past semester is going to show that we're going to be able to meet the challenge of helping the community in the region as well as being a large vaccination site. So we're very excited about that. And now let me move over to how we're doing with mitigation testing. That continues. Last week we tested 7,700 of our students, faculty, and staff, and we're consistently below 1% on the infection rates. So that's a really good sign so far. It sets us up good for to be in a good position to restart the semester. And remind everybody that next Tuesday, the spring semester officially begins, and that will begin with all distance learning for the first 3 weeks. And then on February 8th, we'll go back to having in-person classes for those that were able to have on the campus as well. So we feel like we're in pretty good shape for that. And The move-in week will be the 30th of January, so the campus will start to come alive with congregant living in the residence halls and Greek houses at that time. Our restart plans are on track. We feel confident about those, and we will continue to stay vigilant and monitor and adjust things as we need to. So thank you for the opportunity today, and I'll be pleased to answer questions.
Okay, thanks, Kirk. And the link to that news release about the vaccine sites is in the chat for those of you on the Zoom call. Let's next check what is going on in Monroe County with Penny Caudle.
Good afternoon, thanks. And certainly thank you, Kirk, and the university. We're very excited to be able to add additional opportunities for all of our residents to be vaccinated when they are eligible. And the first thing that I will say to everybody again is be patient. It's coming. It will come to you, and you do need an appointment. So you can visit ourshot.in.gov to schedule your appointment. If you are unable to do that and you need help, 211, you can call 211 and someone will assist you in making that appointment. But we do need people to schedule those appointments. Things around that may change as more vaccine is available and things roll out, but that's the system that we need everyone to operate with at the moment. And so we're excited to be able to add additional sites for individuals. And that's been in our plans all along, to have a variety of closed opportunities using businesses that have employee health clinics. So and we've got many that are, again, kind of standing, they're on deck waiting for that opportunity so that they can also take their employees as they become eligible. So none of this is bypassing that eligibility that's being laid out by the state. So we are excited about that. And we're excited that we were able to open our clinic at the convention center this week. Monday, we opened, we served 70 people, had kind of what I'm gonna say is maybe a little soft opening. It went very, very smooth. Even on Wednesday, we had a longer wait, but things still went very well. They went smoothly. People were very grateful, commented that it was well organized and going smoothly. So every day after we have those clinics, we think about what we can do better and look to do better. So we did 70 on Monday, we did 289 on Wednesday, and we have over 140 scheduled for tomorrow, which is a half day. So we continue and to adjust the schedule. We have to kind of try to figure out what that, I'm going to say, sweet spot is for us to be able to handle now and then handle the additional second doses along with first doses that come in another month. The state actually, we talked to the state about what we feel like we can do and what we want the schedule to look like, but we don't set the schedule. And so a lot of that is based on vaccine that's available, what's being shipped, what's in the pipeline. So as you go on and you may see that there are no appointments, keep checking back, because those appointments will open up as vaccine flows. And that's just an important thing to keep in mind. We're not scheduling appointments when we don't have vaccine. So keep that in mind. It will come, check back. And the other thing that I wanted to say about that, make sure, we've had some people go to the testing site thinking that they were getting their vaccination there. And in some cases, people they scheduled a test. They went on the website to schedule a vaccination, and they ended up on the testing side of things and made an appointment for a test and didn't realize that. So I would just say, check very closely as you're reviewing everything before you exit out. And some people have caught it afterwards and they've let us know, and we've been able to cancel and get them rescheduled for the appropriate thing. But just wanted to share that information so that people are aware that's something to watch for. I've mentioned before, the state is using an age-based approach in terms of eligibility, because the goal is to reduce hospitalizations and deaths first, that's kind of that front line. So obviously we know we started with eligibility for frontline healthcare workers or first responders. Most of our hospitalizations and our deaths are in people who are 80 and over, 70 and over. And so that's how they are rolling out these groups. So as we are making appointments for and covering the population that's eligible now, then the next group will be that 60 to 69. And that's what we're expecting. And after that, the state is looking for where they go from there. What kind of, do they look at underlying conditions, which underlying conditions, and those kinds of things, but looking at the data to try to drive those decisions on who's eligible when. So again, we're still working on the scheduling, bear with us, but stay tuned and we will continue to operate that. We're excited to be able to add additional sites so that people have options. We continue to adapt and look at our plans for doing outreach and meeting people that may not be able to come to us. The state is also engaging with federally qualified health centers and pharmacies to come on board in the future as well. And all of it depends, obviously, on the amount of vaccine that is available to us. Also want to remind you to remember to keep wearing your masks and distancing. We still need those prevention measures for the short term at least. So just because people are being vaccinated, it does not mean that any of us, vaccinated or not, should stop wearing our masks or distancing, staying home when we're sick. We still need to do all of those things. The other thing that I will say in terms of testing site, we've had some reports. Certainly the numbers of people being tested at the Optum site and the community testing site vary from day to day, but over the past few days or week, we've seen some decreases. So I'd encourage people to still remember those testing sites are there for you. If you are a close contact, if you're symptomatic, please get tested. If you think you may have been exposed or you're just concerned, certainly take advantage of that opportunity to get tested. Our community site on Morton does have rapid testing available, so results in 30 minutes or less for people who are symptomatic in the last 7 days with COVID-like symptoms. So please, when you are eligible, consider getting vaccinated. Be patient with us and all of the sites. Right now, I would say if you have mobility issues, the convention center is a better option for you, unless maybe you have someone who is helping you get in and out. But we are all here to serve you and happy to be getting that vaccine out. Thank you.
Okay, let's next go to the Monroe County Board of Commissioners and Julie Thompson.
All right, thank you so much, Chuck. And again, thanks everyone for being here. Just have a few updates for you today. First of all, just so everyone's aware, we are still providing grant money to businesses and social service agencies in the community to cover COVID-related expenses that are non-payroll. These are grants, not loans. And so far this year, we have $10,467 dedicated for businesses, and taxing units are also getting some additional help to the tune of $11,377. I will note that the entire program to date, we have granted $481,759.04. So we're really proud of that. And thank you to our council colleagues for helping us make this happen. If you are a business or social service agency in the community and you need assistance, please go to co.monroe.in.us and fill out the paperwork, the form, and you will be asked for specific documentation. So please do that. Also, we are still helping our township trustees provide assistance for residents in the community to ensure that they have shelter, utilities, and the basic necessities of life. Every county resident is a township resident, so please contact your township trustee if you need assistance. They have additional funding from the county to provide that assistance. I will also note that part of the National Day of Remembrance for those lost to COVID, that day is Tuesday, the 19th of January. We are having a local ceremony, a recognition to remember those we've lost to COVID in our county. That's more than 100 souls, which is just startling. And at 5:30 p.m., the courthouse will be lit in purple, and we will ring the bell for each life lost. We just ask our residents to take a moment and pause at 5:30 to think about all those families and friends and our community and what we've lost this year. We also are inviting houses of worship to join us with bells, lights, or anything else they deem appropriate as well at 5:30 on Tuesday. We will be streaming this live on Facebook. So go to the Commissioner's Facebook page and take a look. So we appreciate the community joining us for that. We'll know we'll all be together in spirit. We're not going to be meeting on the courthouse grounds though. I will also note that this past week, the commissioners have approved a contract addendum with Security 24/7 LLC to provide additional support to the enforcement of the health order locally, and also to provide other assistance to our health department. So we appreciate that. And a big thank you again to the Convention Center. We approved that contract, although they have been very gracious in providing the vaccine site. So we really do appreciate the Convention Center and all their hard work to make this happen. They've really done a great job setting this up and supporting the effort to vaccinate our county residents. Also, just a quick reminder to go to co.monroe.in.us and sign up for the resident alert system. We are sending health orders or health information. Vaccine information has gone out on that. And so if you want to sign up for text, call, or email, or all of the above, you are invited to do so. It's also a good time to do so because we post travel advisories related to the weather and the status of our roadways in the county. So that should also be a big help to you, especially this weekend, as we are expecting some snow. So a reminder that the Martin Luther King Jr. holiday is on Monday. Please, if you can, volunteer with your time, day on, not a day off, but do so safely. We thank all the residents who continue to physically distance and wear their face coverings, and support the great work of all of the entities represented on this call. Thanks, everyone. We'll take questions.
Okay, next go to Monroe County Emergency Management Director, Allison Moore.
Thanks, Chuck. I'm just using audio today. We are fortunate that we were able to receive additional supplies through some of our state resources and traveled to Indianapolis, and we're able to pick up those supplies. Many of those supplies are going to our local law enforcement and local fire departments to keep them safe as they continue to serve the public in this pandemic. And other supplies will be readily available through the Monroe County Emergency Management Office. If you do need a face covering, we have a sheet on our homepage and on our emergency management page at co.monroe.in.us. And there are directions on how to get in touch with a fire department, a township trustee, or our office to pick up those supplies. If you're a business or a social service agency and you serve the public and you need additional supplies, so if the public comes to your location and needs to wear a face covering, we also provide those for you, and you can contact our office. That our contact information is also on that homepage, and we are happy to assist and supply. We also are readily available for this possible weather that's coming. It's already kind of starting to snow flurry since I'm out and about, and on the northern part of the county as we come back. All of our trucks are out and about, and they're doing lots of pre-treating in the highway throughout the county. And I know that our city street department in Ellisville as well will be readily available to try to get our roads in great condition. But we encourage you to stay home, and keeping this call COVID related, I'd like to just say, if for some reason you do have to be out, we encourage you, at all times to have on that face covering. But this might be a great time just to stay home, stay off our roads, and let those trucks do the work to keep those roads clean over the next couple days as weather does come in our area. We have 2 blood drives scheduled for January the 21st and the 28th. And then we also have a blood drive that the city hosts every Wednesday at City Hall. You can schedule for any blood drive in Monroe County at the redcross.org website for a slot and make a donation. If you can make that contribution, it definitely helps our county as blood is continuing to be low due to COVID efforts of our hospital. And that's all I have, Chuck. Thank you so much.
Okay, and I am against the incoming weather that we are facing. I just want to go on the record in saying that. Let's go to Brian Shakney and check on IU Health.
So I'll be the opposite. I'm excited for this snow. I can feel the excitement building in me to be able to build a snowman or do something. We don't get it that often, and when we do, it's exciting in the Shakney household. I'm also excited for the vaccine and all the things that are going on to get us out of this pandemic. We continue to see a steady decline in our volume over the past week in our inpatients, which is a great news. And there in Monroe County as well, we're seeing a decline this week. So we're, again, some excitement. We have guarded, but we are excited to see those numbers come down. As of yesterday, our IU Health ICUs statewide were at 81% occupied regionally, and our ICUs also statewide 81%, and that was the same for our ICU here at IU Health Bloomington. So while our inpatient census remains steady, the worst of COVID isn't over. And as I've stated in this press conference several times over the past year, COVID's devastating results can end in the death of a loved one's family, neighbors, and friends. So as you see on the screen, the Indiana Department of Health reported COVID-19 deaths across the state of Indiana were 2 to 3 times the volumes of deaths per day we saw in April. So the last 90 days, we've seen 58% of all deaths since March, and in the last 45 days, 35% of all deaths. It's important we continue to understand the severity of this virus. As I mentioned earlier, the level of our ICU patients and the severity of our patients is higher than we have seen in the entire pandemic. The virus is here, but the vaccine is our hope for the future. But most importantly, that we need to continue to wear our masks. We need to physically and socially distance, practice terrific hygiene, and decrease all opportunities to come in contact with someone outside of your immediate circle of influence. As Allison said, this might be a good time to stay home and play in the snow. My personal and professional plea to each of you is to get this vaccine when your opportunity comes. In the meantime, again, you know what to do. So we are excited to see the public's interest in receiving the COVID-19 vaccine. This is the important step in fighting the pandemic. As of last night, our COVID-19 vaccine clinic at IU Health Bloomington has utilized over 8,565 of the 11,225 total vaccines we've received. That's 76.3% of the available supply. At the end of our Saturday clinic, we will have given over 10,000 vaccines. We have been given for, which means that's over 81% of our distribution of all vaccine. In addition, starting next week, the IU Health site will add additional vaccine slots, just as we have each week. Remember, our first day, we started with 15 vaccines. Next week, we will begin to offer over 700 vaccines per day. Those are among the most who are excited to drive toward the end of this pandemic. The Indiana State Department of Health will continually ship additional vaccines at the beginning of each week based on the demand and those that are scheduled. So keep scheduling when there are open spots. Keep coming, because the vaccine will continue to arrive here in Monroe County for all of us to be able to vaccinate you. We continue to see minimal side effects from the vaccine. Most people just get a sore arm or have some discomfort for a little while in their arm. And this goes away within 12 hours or so. And I do want to update you on a couple of items related to our vaccine site located at the IU Health Medical Arts Building. It is on 619 West 1st Street. We have produced a video that will help all of those coming to our site to more easily find us and know the process of how to turn in and park and how to pull out. This picture on your screen shows the site on the map, but this video will be posted on our website so that you will be able to go on the website and see how you drive up, how you park, actually go in, the process you go through to help you understand how to navigate. We've had some confusion around that and want to be sure that when you come, you can get easily here and get your vaccine and easily get back to your home. Over the last few weeks, we've heard some truly emotional stories from individuals about what the vaccine means to them. In an effort to truly help you understand the significance of receiving the vaccine, I'd like to share two of these stories. One couple we saw this week had not left their house since March, and now they feel they can make plans again. They can see kids again, spend quality time with their grandkids, because the holidays were not the same again. While they are continuing to shelter in place, they know that there's going to be a time soon when that all will happen. On Monday, we vaccinated a 101-year-old gentleman. He walked into the clinic on his own and out on his own, and he was so very happy to get this vaccine. I put a challenge out: let's be the first county to achieve herd immunity. Thank you to Indiana University. Thank you to everyone who is working to get people to the vaccine clinics, those who are scheduling, those who are continuing to expand the vaccine for our community and for our people that need it most. Thank you for the time today, and I will take questions.
Okay, and we will turn to questions. The first one comes from Dave Askins, the B Square Beacon. This one addressed to Penny and Kirk. Most recent 3 weeks of data really seem to show that the volume of IU's mitigation testing is damping down the positivity rate for the county. This isn't new, but the pattern seems even more clear than ever. Has there been any update from the State Department of Health on the idea of separating out IU's mitigation tests? For IU, would there be any problem flagging those records for mitigation tests so that they could be filtered out by the state?
Yeah, Dave, it's a good question. I will say that with our testing sites, I know with our Morton Street site, the positivity rate is still in that 5% or less range. So that's kind of good information for us to have. We know that with the large volumes that the university does, it certainly can drive down our positivity rate. I have not heard anything more from the state. And to be honest, I think with how quickly the vaccine is here and trying to get that out, that is probably just lower on their priority list. But I will say this, and this is the other piece of the equation we've always talked about, not looking at just one piece of information. And I think this goes to your point. In the last week, we have seen our cases per 100,000 go up by 100. So, we are one of 3 counties that are still at that level 2, which is orange, which is better than most of the state, but we still have a lot of community spread. We know that Indiana has seen at least 1 case of this new strain that is more transmissible. So those are all the reasons we need to stay very vigilant about what we're doing. But absolutely, I have not heard that the state has moved forward with that.
Kirk, do you want to elaborate on that about IU flagging the records?
Well, I think Penny's point is good, that we're still able to look at that locally, but in the big picture, we need to look at the university as the university community really as part of the larger Monroe County community, because just because we're able to do a lot more testing, I think, our numbers probably skew a little lower than you'd find at the community sites, perhaps because we are sending directives to our students, faculty, and staff to show up, or you're non-compliant with your student or employment agreement. So where in the community, I think many folks have a tendency to perhaps kind of even skate a little bit on, maybe they're a little symptomatic and show up at one of the community testing sites, which we do not want. They need to go to a medical site if that's the case, if they're symptomatic. Our folks are being directed to come on a more or less random basis, and if they don't, they have sanctions. So it's a little different way we're asking our people to show up, but they're still a huge part of the county population.
Yeah, Mayor.
If I might just add, I think it's a good question about how that state data is done. I think it is just a reminder to all of us how valuable it is to have this robust background mitigation testing going on of thousands of people in our community. It's what we would have liked to see kind of nationwide, frankly, from the beginning, to have these monitors of regular testing. And if it goes from below 1% to 3%, all of a sudden, I mean, that's a huge and important indicator. And it's incredibly beneficial for us in this community to have that kind of major background testing going on. We appreciate it.
Question again from Dave Adkins for Penny and Brian or anyone else. He says, given that such a large percentage of COVID deaths are among older people, when large numbers of older people are vaccinated, the number of deaths is likely to plummet. They're already going down anyway. That's bound to have an impact on vigilance for basics like distancing, mask wearing, hand washing. Have you thought through any new messaging that will be rolled out in the next few weeks?
I'll go first. Certainly, we are hoping that those hospitalizations and death rates will go down. That is absolutely what we want. And you're right. Oftentimes, we see that when we see positive changes, that people start to kind of relax a little bit. And so we are looking at messaging, how we can do that. I know the state is working on a campaign as well. So there are some other things coming, and we would welcome any partners, people that have ideas and can offer help with those kinds of things, to be a good partner in the community and help share that message that we need to maintain those things. Even with vaccine, we need to maintain our mask wearing and distancing at this time.
I will respond as well. Agree with everything Penny said. That is our goal. How wonderful that we could cut back on the deaths and hospitalizations for our most elderly population, those who, the wisest among us, we always say. But more importantly, actually, since we're seeing this decline in inpatients in our hospitals, we're actually have a grid, as the state does, as color grid. And actually, if we continue to see this decline next week, we will actually be changing our visitation policy and allowing some additional visitors into the facility for patients and with patients. So, we still have to practice all the things that Penny talked about to keep everyone safe, because this doesn't just kill the elderly. There are young people who also this affects in a very negative way. So we still have to do those things, but it does allow us to start getting back to things such as allowing family members at the bedside who are so crucial to that care of that patient. And some of those other things in healthcare as well as in society that we can begin to do again that we've not done for some time, or at a greater number than we've been able to do at some time.
Question from Ethan Burks, WFIU WTIU for Penny. Several people over the age of 70 have said they can't schedule a vaccination due to no availability. Some are even having trouble getting an appointment in nearby counties. Can you speak to any logistical issues your department is seeing? And is there anything you'd like to see more from the state to expedite the process?
Well, it is a complicated logistical process. That is for sure. And as I said, they're not, we don't want to make appointments that we may not have vaccine for. So they do kind of limit how far out they go. We talk with the state what seems like daily about what can we do. And so we had a conversation today about scheduling and what do our appointments need to look like, and can we handle more? Again, the question for everyone, but certainly for us, we have smaller capacity, is whatever we do now in a month, it's going to be double that. So we have to factor that in. So it may seem like we have fewer appointments now because we're going to have twice that in another month, and we just have to calculate that. So we are continuing every day after we have clinic. We are looking at what can we do differently? Can we add staff? And so we are working to do that. We have had, our volunteers have been fabulous. I just want to give a shout out to them. Not only is the staff with IU Health staff, we have a partnership with them. So our nurses are their nurses, and they're terrific. The health department staff's terrific, but our volunteers have just been fabulous. And they're very excited right now to be volunteering as well. And the other thing that I would say, Commissioner Thomas mentioned the convention center. Again, we are very grateful. And they said the other day when I was there that Delaware County heard about our partnership and how we were doing our clinic at the convention center, and called them to see what they were doing and how they were doing it. So again, we're kind of a model for that. I apologize to anybody who's having a difficulty. That the 80 and overs were extremely excited to get the vaccine. The 70 and over are extremely excited to get the vaccine, and that's good. But again, be patient, keep trying. Those appointments continually open up.
Okay. Waiting for some more questions here. We have a few more minutes if someone wants to work one more in. We did have a question from Facebook about the percentage of deaths in nursing homes, and we've noted in the chat that the Indiana Department of Health COVID-19 long-term care dashboard is available at coronavirus.in.gov. So you can check that out there and check those percentages by county, and that includes positive cases, positivity rates, and deaths. Again, we'll await one more question here, and we just need like music or something to count this down when this happens. But be happy to take more. Again, if you missed the announcement at the start about the Indiana University vaccine site, that news release is on our webpage, on our news webpage at news.iu.edu. And if you're on the Zoom call, it is in the chat here as well on a direct link. Well, I'm seeing no more, so I'm inclined to go ahead and wrap it up there. We will be back again, of course, next Friday at 1:15 with more information about the COVID-19 pandemic. Until then, everybody have a good weekend.
Thank you.
Thank you, everyone.
Thank you.
Chuck, thanks everyone.